Facing surgery is one thing, but the real question marks often pop up the moment you wake up. What's next? How do you handle the pain? What should you be eating? Well, today, we're going to swap that anxiety for confidence with a clear plan. This is your post-surgery playbook, a straightforward guide to help you navigate your recovery and get you back on your feet.
Okay, so let's get one thing straight. Your recovery doesn't start when you finally get home. It kicks off the second you wake up from anesthesia. You'll find yourself in a special, highly monitored area called the Post-Anesthesia Care Unit, or PACU for short. Think of it as mission control for your recovery, where a dedicated team makes sure you're stable and comfortable before you head to the next stage.
So here's the game plan for our playbook today. We'll start right there in the PACU. Then we'll dive into the 4 big pillars of your at-home recovery: managing your body's to-do list, fueling up with the right foods, moving safely to prevent problems, and, just as important, keeping an eye on your mood. And we'll wrap up with the critical red flags that tell you it's time to call for help. So what exactly goes on in the PACU? Well, the main goal is actually pretty simple. It's all about monitoring you super closely as the anesthesia wears off. They're there to make sure you have a safe and smooth transition from the operating room to your recovery journey. Before you can get discharged from the PACU, your care team is looking for a few key things to check off their list. They're making sure your vital signs are nice and stable, and that you're awake and pretty alert. And this is a big one. They'll work with you to get your pain down to a level that you can actually manage and make sure any nausea is under control. Once you hit those milestones, you're ready for the next step. All right, you're home. Now we get to focus on the first major pillar, just managing your body's immediate needs. We're going to break this down into 3 key areas: handling your pain, taking care of your incision, and dealing with a super common side effect, constipation. This brings us to probably the single most important rule of post-op pain management: stay ahead of the pain. Seriously, don't wait for the pain to get really bad before you take your medication. The whole idea is to keep it at a tolerable level. And here's a key sign that you're healing right. Your pain should slowly get better over a few days. If it's getting worse, that's your signal to call the doctor. Okay, knowing what to look for at your incision site is huge. A little bit of swelling, some bruising, and even a bit of thin, clear, or yellowish fluid, that's all pretty normal. But what you need to be on the lookout for are the signs of infection. We're talking about discharge that's greenish or smells bad, or if the skin around it gets really red and feels hot, those are crystal clear signs to call your surgeon's office. Anesthesia and pain medicine can really slow down your digestive system, which often leads to constipation. So to get things moving again, think of it as a 3-pronged attack. First, load up on high-fiber foods. Second, you've got to drink plenty of water. Aim for at least 64 ounces a day. And third, try to stay away from foods that can make things worse, like a lot of cheese, red meat, or greasy fried stuff. Next up, let's talk about fuel. What you eat after surgery isn't just about comfort food. It's literally the raw material your body is going to use to repair itself. In this case, food is absolutely a form of medicine. So what should be on your plate? You really want to focus on lean protein. That's what provides the building blocks to rebuild tissue. And vitamin C is so important because it helps your body create collagen, which is basically the scaffolding for new skin. Now, on the flip side, you want to avoid alcohol since it can mess with your medications, and also try to steer clear of highly processed, fatty, or sugary foods that just don't give you the good stuff your body is craving right now. So what if you're just not hungry, or you're feeling a little nauseous? That is totally normal for a few days. The most important thing is, don't force it. Stick with simple, bland foods that are easy on your stomach. And you might want to try eating smaller, more frequent meals instead of trying to tackle 3 big ones. Okay, pillar number 3. Now this one might sound a little backwards at first. You need to rest, of course, but you also absolutely have to move. Getting that balance right is the key to dodging some really serious complications. So you're probably thinking, wait a minute, I'm supposed to be resting, so why on earth is movement so critical? It feels like a contradiction, right? Well, the answer has everything to do with your circulation. And here's why. When you're not moving around a lot, like right after surgery, your blood flow slows way down, especially in your legs. This puts you at a higher risk for something called a deep vein thrombosis, or DVT. That's a blood clot. Gentle movement, especially in your lower legs, gets your calf muscles working, and they act like a natural pump to keep that blood moving and stop those clots from ever forming. And listen, you don't need to run a marathon to make a huge difference here. Simple movements, just like these that you can do right from your chair, are incredibly powerful. The real secret is just being consistent. Try to do a set of these every hour or so. It's such a small effort for a massive, massive payoff when it comes to your safety.
And now for our last pillar, and it's one that honestly gets overlooked way too often. Surgery is a major event for your mind just as much as it is for your body. Your emotional recovery is every bit as important as the physical one. It is completely, 100% normal to have some emotional ups and downs after an operation. But you have to know the difference between just feeling a little blue for a bit and something that's sticking around. If that sadness or anxiety or just a total lack of interest doesn't lift after a couple of weeks, it might be post-surgery depression. Please do not ignore that feeling. Talk to a healthcare provider.
So, what can you actually do to support yourself here? First, lean on your support system. Let your friends and family help you. Be kind to yourself and pace your return to your normal routine. Once your doctor gives you the green light, even gentle exercise like walk-in can be a huge mood booster. And remember, there is absolutely no shame in asking for professional help. We've built our entire playbook, but this last part, this is the stuff you absolutely, positively have to know. These are the non-negotiable red flags, the signs that mean you stop whatever you're doing and get medical help right away. You know, a low-grade fever might be normal for a day or two after surgery, but a fever that sticks around at 101 degrees Fahrenheit or higher is a major red flag for a possible infection. This is not something you wait and see about. It means you need to call your surgeon. Also, keep these critical signs on your radar. Pain that is getting worse instead of better. Any sign that your incision is pulling apart, or if you just can't keep anything down for more than a day. Let me be clear, these are not wait-and-see symptoms. They all require a call to your doctor's office.
And finally, there is one symptom that isn't just a call to your doctor. It's a 911 emergency, and that is sudden, severe shortness of breath. This could be a sign that a blood clot has traveled to your lungs, which is a life-threatening condition called a pulmonary embolism. Do not hesitate. This is the one time you don't even think about it. You call 911 immediately.
Look, your recovery is basically a conversation between you and your body, and this playbook is just here to help you translate. Remember, the goal isn't to recover the fastest, it's to recover the best. You are not just a passenger on this journey, you are the pilot. So the only question left is, are you ready to listen to what your body is telling you?